N.
Heart failure is a complex clinical syndrome with signs and symptoms that result from impairment of ejection of blood from the heart. It remains the leading cause of morbidity and mortality globally, and in the Caribbean region, accounting for approximately 21% of all fatalities annually. The prevalence of heart disease is notably high among Indo-Trinidadians and increases with age. These statistics underscore the critical need for comprehensive public health strategies focusing on prevention, early detection, and effective management of heart failure and related cardiovascular conditions to reduce mortality rates and improve overall health outcomes in Trinidad and Tobago. Dr. Clifford Thomas joins us today to explain the causes of heart failure, its diagnosis and range of treatment options available, as well as the possible complications of this disease. Struggling with focus or mood swings? Vitamin B6 plays a crucial role in brain function, mood regulation, and immune health. Boosts brain function. B6 helps produce neurotransmitters like serotonin and dopamine, which improve mood and memory. Strengthens immunity. It helps your body fight infections and produce red blood cells. Reduces PMS symptoms. B6 is known to ease cramps and mood swings in women. Where can you find vitamin B6? Bananas and potatoes. Great plant sources. Chicken and turkey, protein rich and packed with B6. Nuts and seeds. Almonds and sunflower seeds are great choices. Spinach and avocados, a powerful vitamin-packed combo. Low levels of B6 can cause fatigue, depression, and even weakened immunity. But getting enough keeps your mind sharp and your mood balanced. For a healthy brain and a great mood, get your daily dose of vitamin B6.
Before you take your omega-3 supplement, check for the natural product number NPN on the label. This unique code shows that Jameson products have approved rigorous Health Canada testing for safety and effectiveness. Unlike some supplements that carry disclaimers like not approved by the FDA, Jameson Omega-3 is the trusted choice, offering 1800 milligrams of EPA and DHA for heart health. Choose quality. Choose Jameson.
My name is Dr. Joanne Williams-Carroll, and I am the Director of Behavioral and Mental Health at the Community Hospital. At the Community Hospital, we believe in nurturing mind, body, and soul. Through our counseling and chaplaincy program, we will provide you with support and strength you need to help with your mental and emotional well-being.
Give us a call.
The Community Hospital of Seventh-day Adventist,
Where good private health care is affordable.
So, Doc, Congestive cardiac failure, congestive heart failure. Can you help us understand what that means?
Heart failure is a clinical syndrome that is due to inadequate filling and ejection of blood from the heart.
Ejection meaning pumping blood out of the heart.
That's right. So it's basically an abnormal pump function of the heart. There are two sides of the heart function, pumping, filling of the blood, which occurs during diastole, and contraction during systole. So heart failure could either be systolic dysfunction, weak pump, or diastolic dysfunction. It's not filling properly.
Okay. And in terms of, so most patients would already have an underlying cardiac condition that would have been going on for some period of time, and eventually their heart would have decompensated or not been able to keep up with the workload because of their underlying condition, resulting in this heart failure.
That's correct. There are a number of causes of heart failure.
Yep.
One common cause is blockages in the arteries of the heart, or coronary artery disease, and that causes heart attack, which means a portion of the heart muscle has been damaged. That results in impaired pumping or weakening of the heart function. There are other causes. That's the most common one.
Okay.
Globally, and here in Trinidad, our studies have confirmed that coronary artery disease with previous heart attacks is the most common cause of heart failure.
Okay. And sorry, you were saying other causes?
High blood pressure is a significant factor, because high blood pressure puts an abnormal strain on the heart, which eventually weakens. We call it pressure overload.
Okay.
Valve problems of the heart, a leaking valve or a narrowed valve, can put a strain on the heart. Heavy alcohol consumption is another reason for heart failure.
Okay.
So these are some of the causes of heart failure.
I think a lot of people have to be cognizant of the fact that the heart muscle never stops, it never rests. And if you were to consider the fact that the heart has to be repeatedly, consistently operating, probably sometimes faster than at other times, depending on the demand for blood and oxygen. And if you have an underlying condition, eventually you are going to tip it into failure. So if a patient has heart disease, what sort of signs and symptoms should their relatives or them observe if they are going into heart failure or already in heart failure?
That's an excellent question. The symptoms of heart failure are related to inadequate or low cardiac output, as well as congestion, retention of a lot of fluid, and abnormal rhythms. The low output will cause the person to be tired easily. So this is different from feeling tired in the morning. This is tiredness, particularly with exertion. And as it gets worse, less and less exertion will cause the person to feel tired. Medical term we use is fatigue. Mm-hmm. The fluid retention occurs in the lungs, and they get short of breath, particularly with exertion. And there's a particularly condition where when lying down, they feel short of breath and have to use a lot of pillows. That's a sign that the shortness of breath might be due to heart failure. Finally, the fluid retention can cause swelling of the abdomen and the legs.
Okay. I wanted you to go back to the fluid retention in the lungs. You were talking about lying down flat. That's an important telltale sign that people should be aware and observe in their relatives if they need to prop up with how many pillows is what is your gauge to know that this is problematic in my dad or my uncle?
Well, typically...
1 pillow, 2 pillows?
Well, first of all, using pillows and being propped up on pillows there are a number of reasons for it. So it usually will require a doctor to sift through to determine whether that is related to heart failure, or some people are uncomfortable in a particular position. But typically, the person will find that when they lie down flat, they feel uncomfortable with their breathing, they start using one pillow, they prop it up with two pillows, and in severe cases, they cannot lie down and sleep sitting up in bed.
Almost like what, 45 degrees or actual sitting up to sleep?
In severe cases, they're practically almost sitting up.
Okay. And I would imagine tying in with all the pulmonary congestion would be coughing?
Yes, so the coughing is a symptom of usually respiratory problems, but the coughing in heart failure typically will cause sputum to be frothy as opposed to cream or blood, or it's usually a frothy sputum.
Frothy white sputum, no discoloration to suggest an underlying infection at all.
Correct.
All right. And chest pains? Any chest pains or?
Chest pain isn't a symptom of heart failure per se, but it might point to the underlying cause, because coronary artery disease or heart attacks can cause chest pain.
Okay.
So if that is the cause of the heart failure, the patient may have a history of getting angina, chest pain with exertion, or a severe episode of chest pain, which was diagnosed as a heart attack.
Right. And so you were talking about the leg swelling. And swelling in the legs can be caused by heart failure, as you said, but other diseases can cause leg swelling as well.
Correct.
That may not necessarily be due to heart. So I would imagine if a person is being worked up for possible heart failure, there are certain diagnostic tests that need to be done to eliminate the other causes of leg swelling.
Correct. So we will get patients who present with swelling of the legs, and we have to consider the possible causes. I look at it like this. Number one, the heart. Heart failure can cause swelling of the legs. Number two, kidneys. Kidney failure or a condition called nephrotic syndrome can cause swelling of the legs. Number three, liver problems. Cirrhosis of the liver causes swelling of the abdomen as well as the legs. Yeah. And number four, circulation in the veins and lymphatics of the legs. Problems there can cause swelling of the legs.
Yeah.
So severe varicose veins or veins that are not working well, valves are leaking, or even lymphatic problems can cause swelling of the legs.
Right. And with all those that you just called, except for the veins in the legs, patients will present with both legs swelling together, as opposed to veins, it will probably be one leg or one leg more than the other.
Right. So heart failure, kidney problems, and liver problems will cause bilateral swelling, so it'll be both legs.
Okay.
Problems in the circulation can be both, but more often it is one more than
the next, asymmetrical presentation. So
one serious problem that has to be differentiated is what we call deep vein thrombosis.
Yeah.
Clots in a vein of the leg, which can travel to the lung, causing a pulmonary embolism.
yeah, and it will present similar to heart failure with the shortness of breath and the inability to take a deep breath, chest pains maybe, and the leg swelling. So
correct, but with a careful history, the physician would pick up, which one it is likely, and would be able to use the appropriate investigations.
So I'm glad you're right. You bring this up. So the patient should and ought to go to a cardiologist to get sorted out if they suspect they have any of these symptoms and they suspect heart failure. So what sort of investigations should they expect to take place to make that diagnosis of heart failure?
Well, I would say that the cardiologist is a person who has the tools to best make the diagnosis and treat. But many patients will be seen by a primary care physician who would realize that something is pointing to heart disease and initiate the investigations and refer. So it's important for all physicians to be aware of this condition and know when this is something that needs further evaluation by a cardiologist.
Okay.
Investigations, well, There are a number of investigations which can be used in evaluating a patient with heart failure. Easily available investigations include a chest x-ray, where you might see an enlargement of the heart and shadowing the lungs representing fluids. But we like to be able to pick things up at an earlier stage. And the test which can do that is an echocardiogram, which is ultrasound imaging of the heart. And one can see the heart structure as well as its function and quantitate the severity of the dysfunction.
Right, and that's the beauty of the ultrasound, is everything is in real time. So you're looking at blood flowing through the heart valves, and as you say, working out the parameters in terms of ejection fraction, and that helps you to determine the degree of heart failure, because there are different degrees, there are different stages of heart failure.
Correct. So I'll stress that echocardiogram is basically ultrasound imaging of the heart. So it's a non-invasive procedure. We are able to look at the structure, and the parameter that we often talk about is the ejection fraction. The normal heart, when it fills, suppose it fills with about 100 mils of blood, will pump out about 60 mils. So we call that an ejection fraction of 60%. It is pumping 60 out of the 100 mils that have just filled. A heart that is weak will have a low ejection fraction, below 60%. So the ejection fraction is one of the parameters that we look at in making the diagnosis and following up the response to treatment.
So what's next after, let's just say, you did an echo on a patient, and they at the bedside, you decide, or you realize the ejection fraction is 50% or 40%. What's next?
Or 20%.
Or 20%.
Well, I tell my patients that heart failure, which should be differentiated from heart attack and cardiac arrest.
Please specify. Let's just describe each one and separate them.
Good. So heart failure means that the heart is not pumping efficiently. It doesn't mean the heart's not working. Heart or cardiac arrest, it means that the heart has stopped. And if that is not dealt with immediately by shocking the heart back to life, that will result in death. A heart attack is a blockage in an artery of the heart that causes damage to the heart. So those are three terms: heart failure, heart attacks, and cardiac arrest. But we are talking about heart failure.
Right. And your management of a patient with heart failure will depend on the degree of heart failure, the degree of inability to pump the blood out.
Right. The treatment is
variable.
Is mainly medical, and we have medications which are used to treat heart failure. There have been improvement in the medications, so much so that we have quite a lot of patients who are actually doing well on treatment.
Can you reverse it? You are able to reverse it back to what they were before with the medication?
Unfortunately, it's a chronic condition, but we do get cases where the ejection fraction has improved back to normal, with ejection fraction remains stable, and sometimes we can slow the deterioration in the ejection fraction.
Okay. So prevent it from progressing onwards.
Prevent it from progressing. The medications would be medications that deal with the fluid retention, and those are called diuretics. Diuretics will make the person pass a lot of blood, a lot of fluid in their urine.
Yeah.
So the kidneys are kicked into opening up and getting rid of the retained fluid. And that helps with the symptoms. It's very important treatment. We use medications that lower the blood pressure and take the strain off the weakened heart.
Okay.
And we use medications that slow the heart rate down, because one of the compensatory mechanisms in heart failure is because the heart is pumping so weak, it heart rate increases.
To get the blood where it needs to go.
Correct. But if that heart rate is continually going at such a fast rate, the heart eventually tires. So we've learned that we need to use medications that slow the heart rate.
Okay.
Those are some of the key medications, and there are other new medications which make a huge difference in terms of the outcome.
Now, we'll get back to the medication. I wanted to take you back to the fact that heart failure occurs in patients who already have an underlying cardiac condition, but not every cardiac patient will move on or progress to heart failure. What's the determining factor? What are the factors that predispose a patient to progress and deteriorate into heart failure?
That's a difficult question, but let's start off by looking at some of the risk factors for heart disease. Hypertension, diabetes, obesity, cholesterol problems. These are some of the reasons why people develop heart disease. And much of this can be prevented. There are other conditions, of course, which we talked about, that if they can be recognized and treated, for instance, some people have an overactive thyroid, which if picked up early, we can prevent that from progressing. Alcohol, heart disease is completely preventable if we can stop.
So it's mainly lifestyle that will tip a patient who already has cardiac disease into failure. Things that they can easily prevent and
right, but they're not all conditions that cause heart failure are we able to prevent. So it's important to be able to recognize the symptoms and signs early and treat early and with effective treatment.
Okay. And I know that your facility, your clinic, Premier Heart Care Limited, has been conducting research recently, both in Trinidad and Tobago, with respect to heart failure. Can you tell us exactly what have you been finding out so far? Is the research completed?
Right. So I'll highlight maybe 2 or 3 of some of the research work that has been done. First of all, we have looked at heart failure patients that we've confirmed with echo, and we have looked at the causes for heart failure in our community. We have looked at the response to treatment. So we have noticed a significant number of patients that when we use what we call guideline-directed medical therapy effectively, we're getting a significant percentage of our patients who have an improved ejection fraction or stabilize.
Brilliant.
Importantly, though, we have learned that if we have an improvement in ejection fraction, the patient does need to continue treatment, because if they do stop, the ejection fraction can fall back down.
So this is a lifelong undertaking.
It requires continual follow-up. So we have got our data on heart failure patients. 2, we have done a population-based study in Tobago. It's a NIH-funded study with the University of Pittsburgh, collaborating with Vanderbilt University, as well as the University of West Indies. And we are looking at heart function in the adult Tobago population.
Okay.
So we are looking by echo and ECGs in an adult population, and we're seeing the incidence or the prevalence of abnormal heart function, which may precede heart failure.
Okay. Wow.
So this will provide a lot of information that we can use for our people, because many of the international studies do not take minority groups. So it's difficult to extrapolate that information. So we are now able to do just that.
That's amazing. That's amazing. I'm so sorry we ran out of time. But before we go, if there is one piece of advice, one golden nugget of information that you would like to leave with our viewers concerning heart failure and heart disease as a whole, what would that be?
we would like to be able to provide the whole spectrum of treatment, from prevention to medication, right down one day to be able to be performing heart transplantation here in Trinidad and Tobago. And that is some of the research that our colleagues have been collaborating with us in the United States.
Thank you, Doc.
Thank you for having me.
My name is Dr. Stephen Carroll, the CEO at Community Hospital of Seventh-day Adventist, and we are committed to making good private healthcare affordable.
For all your medical needs, including dental, radiology, laparoscopy, behavioral and mental health, along with many other services, contact us for more information at 235-5479.
Community Hospital of Seventh-day Adventist,
where good private health care is affordable.
Before you take your omega-3 supplement, check for the natural product number NPN on the label. This unique code shows that Jameson products have approved rigorous Health Canada testing for safety and effectiveness. Unlike some supplements that carry disclaimers like not approved by the FDA, Jameson Omega-3 is the trusted choice, offering 1800 milligrams of EPA and DHA for heart health. Choose quality. Choose Jameson.
Ladies, this recipe is for you. If you are looking for a low-calorie but highly sumptuous, delicious, and easy to prepare meal, Chef Emmanuel has designed a nice meal for you. It's called zucchini noodles with pesto and grilled shrimp. Chef.
We feel that about 50% of women who are infertile or subfertile, endometriosis is an underlying factor. So it used to play a role.
Half of the women who present with infertility problems will turn out to have
an underlying endometriosis as a cofactor affecting their fertility.
W